just over half an hour's notice that the meeting planned for this evening with the Basic Education Minister Angie Motshekga to explain whether schools will still reopen tomorrow has now been postponed. It will be held at 11 tomorrow. You'll know that at least one newspaper, the Sunday Times, I should mention the name, they have reported this morning that the decision to reopen schools for matrics and grade 7s has been reviewed and that schools won't reopen. So, as we speak, as I speak to you now, I'm afraid I'm unable to tell you whether you should send your child to school tomorrow or not. There's some children I know who are at boarding school. I don't know what to say to you about them, and I don't know what to say to you about your plans for tomorrow. But let's talk about the health of children at school. The executive member of the South African Pediatric Association, Professor Haroon Saloojee, joins me now. Professor Saloojee, good afternoon to you. Thank you for your time today. I have children at primary school. They weren't due to go back tomorrow, but they certainly have friends and members of the family who are. Is it safe to send young children to school at the moment?
So the answer is, the short answer is yes. So our association has contemplated this issue in quite a lot of detail, looked at the evidence, and our view is that children in South Africa should be returning to school, certainly the grade 7s and 12s tomorrow, and many of the other children, including the younger children, as soon as possible. There's obviously gazetted dates. And I think the key point we want to make is that children are not the same as adults. There's now mounting evidence that children can go to school and not get COVID. We know that there's lower risk of acquiring the disease, probably at least about a third less chance of acquiring disease. If they get the disease, it's a much milder disease, and very few children die of COVID. So there's a lot of anxiety out there, but I think our message to parents is that COVID is a very different entity in young children, and going to school will increase their risk of getting COVID, but all these terrible outcomes that we hear in adults are not likely to happen in children.
Am I right? Is this different from other coronaviruses? I mean, we all, any of us with young children will know how they get sniffles, how they get colds, how they, get sick, the whole family gets sick. It seems the coronavirus, this virus, is very different to the others. Seem to have lost Professor Saloojee there. Not quite sure what's happened to that Skype line, but just there he is. I think he's back with us now. Professor, I was asking you, is this coronavirus different to other coronaviruses in children?
So there are different coronaviruses. There was a study recently done in Soweto where, in fact, we found other types of coronaviruses. 15% of children have been exposed. So, yes, children have been exposed to other coronavirus, but this one is new. That's all we can say. And as I said, it's relatively mild as a virus goes compared to adults and children.
Okay, I do need to ask you about spreading the disease. We know that in this country there are millions of children who are cared for by elder relatives. These people may have comorbidities, or better phrases, underlying conditions that make them vulnerable. Do children spread the disease? Do they put those people more at risk?
So that's the question where the evidence is still a little bit uncertain. What we know is that children have much lower viral loads, and what that means is your ability to spread is often related to how much virus you have in your body. And children probably have at least half as much as adults. The transmission studies have shown that, in fact, most adults get their disease from adults. And in fact, very few get it from children. We've got studies from Wuhan in China. We've got studies from elsewhere. So there's been this fear that allowing children to come to school, they'll get infected. I've said they're not at any major risk, but perhaps the danger is to the family and Gogo and to Opa at home. And again, the evidence suggests that risk is there, but in fact, grandparents and family members are much more likely to get it from other adults. So it's not a zero risk, but it's not a major risk, and certainly not enough to say children shouldn't be going to school.
Okay, so what should I do? And I mean, again, being a parent, you always want to protect your child from absolutely everything. One of the hardest things in life is to know that you can't. What should you do to protect them? And obviously face masks are mandatory.
Well, in fact, the key intervention would be distancing. So in fact, even face masks, the evidence is not clear, not only for children, but for adults, how useful they are. But I think it's now widely accepted that they should be used. So there's been a lot of talk about PPE. But what PPE in the classroom really means is a face mask. and then the ability to wash your hands or to use a sanitizer, and that's it. The other key factor, as I said, is physical distancing, and that's about 1 meter is what the World Health Organization suggested. So there's been a lot of talk about schools not having the PPE, but in fact what we're talking about is a mask and perhaps soap and sanitizer.
And the science
and if you can get that, your child should be going to school.
Okay. And the science on this, I imagine, is moving very quickly. I mean, I don't think any virus has been studied as quickly as this virus. That means we will get more information about its impact on children and about whether or not they spread the disease, and if so, how. We'll get that information quite quickly?
Well, it's not quickly. I mean, every week I'm hearing more and more about this. And the science changes. I've just mentioned about viral loads being lower in children. I read an article 2 weeks ago that suggested they were spreading as much as adults. But the same studies were analyzed by another group of statisticians, and they've come to a different conclusion. So the science is rapidly increasing, and we're changing our views. But I think certainly when schools closed, everyone agreed that it was unsafe. But in the last 2 months, we've learned lots more about coronavirus in children. We've learned lots more about the science. And it's becoming apparent that children are, one, not at risk, are not spreading as much, and the science has changed, and it will continue evolving. But I think the other key point that I want to highlight is that we've recognized that coronavirus, we're in for the long haul, that it's not going to be any better next month. In fact, it's probably going to be worse, that the risk is going to be probably most of this year and even next year. And so we're going to have to make this decision of children going to school. And even though this is not the best time, because at the country level, we know we're getting increasing amount of the virus, of the disease in the next 2 months, it certainly is as good as any time to get children in, because it's a risk-benefit analysis. And so we've talked about the risk for children. I've said even for families, children are not the major spreaders. But the benefits are enormous, and I think that's what we're really arguing, that children have been the losers in the whole COVID, that in the interest of adults, children have been, their education has been sacrificed, nutrition, many children depend on the school nutrition program for at least 1 meal a day, their mental health, the social well-being. A lot of children, we've heard about the increasing amount of abuse and violence at home, and schools often are a source of children finding the help they need. So there's many good reasons why children should be going back to school. And many of the arguments that I've heard today and yesterday from the unions, as the discussion you just had, some of these kind of non-negotiables are actually ridiculous. For example, we've heard that some of the schools, only 37% of schools have been decontaminated. Now, why do you need decontamination? We know that the virus lasts on surface for 2 to 3 days. Even if the virus was around it when schools closed on March the 18th, after 3 days that virus is gone. So this deep cleaning and deep sanitation, I accept it's a DBE requirement, but it makes absolutely no sense. There's no virus in schools currently because there's no humans there. The virus will certainly come through in the next few days as children, and we'll have to make sure they're sanitizing then. But there's these kind of requirements that I find crazy, and the science doesn't support a lot of the actions that are happening.
Professor Haroon Saloojee, thank you very much indeed. Right.